As many as 1 in 5 people over age 55 has some degree of mitral valve regurgitation. Doctors Ramesh Bansal and Wang of San Antonio Community Hospital in Upland explain the condition and what can be done to repair the problem.
Mitral valve is a door-like structure which is present between the two left-sided chambers of the heart. Left upper chamber is called left atrium, left lower chamber is called left ventricle. It's a valve that is present between these two chambers. Most of the time this valve functions normally. That means it opens when it should and it closes when it should. But in certain cases, mitral valve can become leaky. That means the two leaflets that are components of this valve, they do not completely close. And that condition is called mitral regurgitation.
It's estimated that over about a third of the population over the age of 60 years old have some degree of mitral regurgitation. The most common form of mitral regurgitation is mitral valve prolapse. In that particular condition, it affects 5 to 10% of the population. So it's a fairly common condition.
Many patients will have no symptoms in spite of presence of severe mitral regurgitation. And a heart murmur is generally picked up during routine examination in these patients. But when the regurgitation is advanced, it leads to symptoms of heart failure, mainly shortness of breath during activities and symptoms of fatigue. When there is severe leak through the valve, main treatment is surgical. And in surgery, we can either replace the valve and put an artificial valve in or repair the valve.
Repairing the mitral valve is very much like having plastic surgery done, except it's done inside the heart. We remove the most diseased portion of the valve and use normal portion of the valve and reconstruct it back to what it's supposed to look like. We almost always put a band or ring to support our repair by remodeling or reducing the size and the shape of the supporting annulus.
Planning of operation is very crucial for successful outcome of the repair. Prior to surgery, the main technique that we use is echocardiography. And echocardiography is an ultrasound-based imaging technique of the heart. Using ultrasound, we can get pictures of the heart and the valve, and we can comprehensively, in detail, study the entire valve and the whole apparatus. Then based on those findings, we can plan whether or not it is suitable for repair or we have to replace it. We sit down with the surgeons and work as a team to plan the surgery.
For most patients with limited disease, whether it is mitral valve prolapse or whether it is mitral valve regurgitation from, say, heart attack, many of these patients would have a very good long-term durable outcome. In other words, they do not have to look forward to further operation. For patients with very extensive disease, on the other hand, the long-term predictable outcome will be somewhat less. We are getting more experience in patients, say, with severe heart failure, patients who are even waiting for heart transplant. Many of these patients can have their mitral valve repair, and the short-term outcome is very good.